Did you know that fatty liver and diabetes often go hand in hand? Yes, it's a surprising fact, but these two health conditions often share a surprising and unseen connection. Let's delve a little deeper into this. Fatty liver, medically known as hepatic steatosis, is a condition where excess fat builds up in the liver. It's normal to have a small amount of fat in your liver, but too much can become a health problem. Now you might be wondering, how does this relate to diabetes? Well, diabetes is a chronic disease characterized by high levels of sugar in the blood. It happens when your body is not able to make or use insulin properly. Insulin is a hormone that helps glucose or sugar get into your cells to give them energy. And here's where the unseen connection comes into play. Fatty liver can increase insulin resistance, making it harder for your body to control blood sugar levels. This, in turn, can lead to the development of type 2 diabetes. But the connection doesn't stop there. If you already have diabetes, especially type 2, you're more likely to develop fatty liver disease. High blood sugar levels can lead to the accumulation of fat in the liver, and this can worsen insulin resistance, creating a vicious cycle. So you see, there's a deep, often unseen connection between fatty liver and diabetes. They can fuel each other, leading to a worsening of both conditions. This isn't to cause alarm, but rather to shed light on how interconnected our body systems are and how important it is to manage our health holistically. Understanding this connection is a vital first step in managing these dual health conditions. It's not just about treating one disease or the other. It's about understanding how they interact, how one can exacerbate the other, and how managing one can help manage the other. So, if you're dealing with one of these conditions, it's crucial to understand the other one too. But what exactly is a fatty liver, and why should it concern you? Imagine your liver as a busy factory, tirelessly working to filter and detoxify your blood, store energy, and produce proteins vital for your body's function. Now, imagine that this factory starts getting bogged down with excess fat. That's the essence of fatty liver disease. In medical terms, it's called hepatic steatosis. This condition occurs when more than 5 to 10% of your liver's weight is fat. It's like asking your factory to work while cluttered with unnecessary material, affecting its efficiency and potentially causing damage over time. Now, you might be wondering, how does all that fat end up in the liver? Well, the two major culprits are unhealthy diets and sedentary lifestyles. Consuming excessive amounts of processed foods, sugary drinks, and alcohol can overload your liver with fats. Couple this with a lack of physical activity, and your body doesn't burn off these fats as it should, leading to accumulation in the liver. But here's the catch. Fatty liver often comes with no symptoms. It's a silent threat, sneaking up on you without any warning signs. You might feel completely normal, even while your liver is getting flooded with fat. This is why it's often called the silent disease. You may not know you have it until it's advanced to a more serious stage, like non-alcoholic steatohepatitis, which is inflammation and damage to the liver cells, or even cirrhosis, which is severe scarring of the liver. And let's not forget about the connection to diabetes. A fatty liver can make it harder for your body to control your blood sugar levels, setting the stage for type 2 diabetes. So while fatty liver might seem harmless at first glance, it's a condition that merits our attention. It's a silent threat that, if left unchecked, can disrupt our body's vital functions and pave the way for other serious health conditions. And if left untreated, this silent threat can lead to more serious health problems. So, how about diabetes? How does it play into this equation? Well, let's unravel this mystery. Diabetes is a health condition characterized by an excess of sugar in the bloodstream. Now, sugar, or glucose, is not a villain in itself. It's the fuel our bodies run on. But when there's too much of it, the balance is disrupted, and that's when the problems begin. You see, our bodies are like finely tuned machines, and glucose is the premium-grade fuel that powers us. But what happens when you overfill your car's gas tank? It spills over, doesn't it? The same thing happens in our bodies. When there's too much glucose, it starts to spill over into various organs and tissues, including the liver. Now, your liver is a robust organ. It's a detox powerhouse, a metabolic maestro, and a storage unit for energy reserves. But even the liver has its limits. When it's constantly bombarded with excess glucose, it starts to store it as fat. Over time, this fat accumulation can lead to fatty liver disease. But that's not all. High blood sugar levels can also cause damage on a microscopic level. It can harm the tiny blood vessels that supply oxygen and nutrients to your organs. When these vessels are damaged, it's like a roadblock on a busy highway. Everything comes to a halt. This disruption can lead to a cascade of health issues, from kidney disease to heart problems, and yes, even more damage to the liver. So, as you can see, diabetes is not just about high blood sugar. It's about a chain reaction of damage that can affect your entire body. It's a sugar bandit, stealing your health bit by bit. And your liver, that hard-working organ, is one of its prime targets. Clearly, managing diabetes is about more than just keeping your sweet tooth in check. It's about maintaining the balance and harmony of your entire system. Because when one part is out of sync, it can throw everything else off balance. So let's keep our bodies in tune, shall we? So, what can you do if you're dealing with both fatty liver and diabetes? It's important to understand that managing these dual health conditions isn't about swinging from one extreme to another. It's about finding a balance. A comprehensive approach that looks at your overall lifestyle is key to dealing with both diabetes and fatty liver effectively. Diet plays a significant role in this management approach. You've probably heard the saying, "You are what you eat," right? Well, it's particularly true when it comes to managing diabetes and fatty liver. The food you consume affects your blood sugar levels and liver health. A balanced diet rich in lean proteins, whole grains, and plenty of fresh fruits and vegetables can help control blood sugar levels and reduce fat in your liver. Then there's exercise. Regular physical activity is just as critical as diet in controlling both conditions. It helps to lower blood sugar levels, aids in weight loss, and can reduce fat stored in the liver. It doesn't have to be anything strenuous. Even a brisk walk for 30 minutes a day can make a significant difference. Medication is another crucial aspect of this dual management approach. Depending on your specific situation, your healthcare provider may recommend certain medications to help control your blood sugar levels or to treat fatty liver disease. It's essential to stick to your medication regimen and to discuss any side effects or concerns with your healthcare provider. The dual management approach to diabetes and fatty liver isn't a quick fix. It's a long-term commitment to your health and well-being. It's about making conscious decisions every day that support your health, whether that's choosing a salad over a cheeseburger or taking a walk instead of watching TV. Remember, it's not about quick fixes, but about a sustained commitment to your health. Your health is an investment, and the returns on that investment are invaluable. So take the time to invest in yourself. Your body will thank you. So, what's your next step in managing these dual health conditions? As we've been discussing, managing fatty liver and diabetes simultaneously is a delicate balancing act. But remember, you're not alone in this journey. Healthcare professionals are the co-pilots to your wellness journey, providing expert guidance and personalized advice based on your unique situation. It's essential to keep an open line of communication with your doctors. Share your concerns, ask questions, and most importantly, always be honest about your lifestyle habits. They can't help you if they don't know the full story. Regular checkups are the cornerstone of early detection and management. They provide a snapshot of your health, revealing any potential issues lurking beneath the surface. You see, both fatty liver and diabetes can be silent threats. They often don't present noticeable symptoms until they've progressed significantly, making regular health screenings crucial. If you haven't already, it's time to schedule your checkup. Don't postpone it, thinking it's not urgent. Early detection is your best defense. It provides you with the advantage of time, allowing you to take proactive measures before the conditions worsen. And while medical professionals play a significant role, ultimately, your health is in your hands. You have the power to make lifestyle changes that can drastically improve your health. Eating a balanced diet, getting regular exercise, reducing alcohol intake, and managing your stress levels are all within your control. Remember, health isn't a destination, it's a journey. And every step you take towards better health, no matter how small, is a victory. So are you ready to take action? Are you ready to prioritize your health and well-being? Are you ready to manage these dual health conditions and work towards optimal wellness? If your answer is yes, then let's get started. Your health is in your hands. It's time to take action.